In this video, we'll talk about glomus tumor. It is a benign neoplasm of glomus body which is present in the fingertips. The main function of this glomus body is thermoregulation, right? So whenever there is change in temperature, sudden change in temperature, it will cause pain to this tumor. So this is severely painful condition, right? And also this glomus body is highly vascular. This all bluish blackish area which you see is a glomus tumor. This glomus tumor, which is also known as glomangioma, it is a benign neoplasm of cells of glomus body. So glomus body is present in the fingertips. It is highly vascular structure and the main function is thermoregulation. So what do you mean by thermoregulation? It regulates this peripheral blood flow to the digits, right? So the size of glomus tumor is usually 2 to 3 millimeter, but the pain is very out of proportion to the size, right? It is a benign neoplasm of glomus body. So it is a purplish or the reddish swelling which do not blanch on the percussion. So the pain is out of proportion. Even on mildly touching the nail or mild pressure or changing in the temperature, it will cause severe pain and the severe burning sensation. So what do you mean by cold stimulus? So whenever this limb is exposed to sudden cold temperature, because of the sudden change in temperature, it will cause intense painful condition. It becomes compressible. This glomus tumor becomes compressible and it will be very painful condition. So if you increase the pressure of the arm above the systole, the pain disappears. And also it can cause nail dystrophies or the bluish reddish flush which we have seen in the picture, right? So histopathology, it is well circumscribed and it has three things. One is the glomus cells, second is the vasculature, and third is the smooth muscle cells. So based on the different proportions of these three different things, you have various names for this glomus tumors. One, it is called as solid glomus tumor if the smooth muscle component is prominent and the vasculature is less. It is called as glomangioma. Angioma usually refers to the blood vessels, right? So glomangioma when there is prominent vasculature. So what is the treatment? First we'll do this Doppler ultrasound for the nail and then it is followed by excision. And the differential diagnosis, if it is subungual melanoma, it will be painless. But if it is pyogenic granuloma, it is bleeding on touch. So the feature which you see in glomus tumor is painful condition. It is a very painful condition, and whenever you touch it, whenever mild pressure is applied or whenever there is change in temperature, it will be severely painful. So this is about glomus tumor. So in this picture you can see this glomus tumor is being removed. So this is the glomus tumor here which is being removed, and here you can see this removed or the excised piece of